Thanks for joining us tonight. Senator Chuck Grassley visiting a clinic in Muscatine to discuss potential changes in Medicaid. Joe Habersham joins us in studio to tell us about the other big issue the clinic is facing. Good evening, Joe.
Good evening, John. Over 650,000 Iowans rely on Medicaid for health coverage. That's according to a 2024 report from the Kaiser Family Foundation. And while potential cuts to Medicaid could keep families from seeing their doctors, a statewide physician shortage is already working against them.
There are many other things that can be done.
With medical leaders fearing cuts to Medicaid,
It's an absolute necessary thing to make sure that people get the proper service they're entitled to.
Iowa Senator Chuck Grassley visited the Unity Point Mulberry Clinic.
How much is the awareness of kind of the real struggle of cost?
Listening to concerns from providers and the community, hoping to reassure their future.
We are going to make sure that Medicaid continues to serve the people that are underserved, that are vulnerable.
Monday's meeting comes after the U.S. House approved a government budget last week. The National Low-Income Housing Coalition believes the budget will cut at least $1.5 trillion in federal programs like SNAP and Medicaid. Republican lawmakers say they don't want any benefit cuts. The Mulberry Clinic makes roughly 45% of its revenue off Medicaid, but there's an even bigger issue on providers' minds.
Healthcare is also dependent on having the right supply of the right types of physicians in the right place at the right time.
Iowa is currently facing a shortage of physicians. According to the Iowa Medical Society, medical school graduates are seeing an average debt of $227,000. The organization believes this causes many to pick specialties and locations that will help move them out of significant debt.
If we can do something to decrease the time it takes to get through medical school, to decrease the cost that it takes to go through medical school, we'll have more people enrolling. We'll have more people interested in becoming physicians.
Iowa's physician reimbursement also falls under the national average. The Medical Society says 400 physicians stop practicing in Iowa every year, with nearly half relocating to another state. John?